I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about bleeding after sex. What to do about it, when is it benign, when is it not, and how you should go and get followed up, or when rather. Remember, this is not meant to be any type of medical advice. So if you have any questions about your health, make sure you go speak with your healthcare provider. And if you have any questions about your religion, make sure you go speak with your neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. Now, this is our annual February series. So in this month, if you remember, if you've been following my podcast, and even if you haven't, no big deal. During the month of February, I like to do 4 episodes on whether it's intimacy, relationships, it's, sex, if it's orgasm, all that stuff. So I have a lot of good sessions for you guys coming up. They're always good sessions, but these are specific to February, and I'm excited for you guys all to be here and learn with me. So here we go. So this episode, like I mentioned, is about bleeding after sex and when it's benign, when it's not, and what to do next. Okay. So this is actually, so the way that I got some of these topics is I just, kind of looked up, like, what are things that people are really concerned about? What do they go to their provider mostly for? And, when it comes to sex, and this was one of the topics. So let's talk about something that sends a lot of people to Google late at night, right? And this is bleeding after sex. And a lot of times, most of the time, actually, when this happens, it can be very alarming, very upsetting. And so let's talk about it. It can definitely bring up fear, embarrassment, and definitely shame. And, after intimacy, when you start bleeding, it's very upsetting. So let's figure out what can happen. It's definitely not something that a lot of people talk about, but it is something that I see in the office and in the clinic. And, I want you to be aware of what are some of the things that can cause that. Bleeding after sex is not, always dangerous. It can happen, right? So it doesn't mean that there's something that's awful or a cancer or something like that. It can happen on occasion, but if it's a repetitive problem, you definitely want to get it checked out. It's not something that you want to ignore. And most of the time, I will say that it is benign. And sometimes it's your body just asking for attention. And rarely, but really importantly, it can be a sign of something more serious. So you do want to pay attention if this happens. Now, in medicine, we call bleeding after intercourse postcoital bleeding. So what that means is that just bleeding after sex. And it happens more often than a lot of people realize. So, and, the experience can vary widely. A lot of times when it's benign, it can be either mild or self-limited. Sometimes it can occur in younger women, and it can happen in the setting of a normal appearing cervix. In those situations, typically, we'll take a look at the cervix. So what happens, right? So when you call up your doctor's office, you say, I've been noticing some bleeding after sex. Your doctor will have you come in, they'll check you out, they'll do a speculum exam, and of course, they'll make sure that there's no active bleeding. And especially, one of the things that I want to make sure that you learn and know about is that if you are pregnant and have bleeding after sex, that is super important, right? So you want to make sure that you get that checked out. Sometimes it can just be that, the penis is hitting the cervix, and the cervix is a little bit what we call friable, meaning like, anything that touches it can sometimes cause it to bleed or spot a little bit, right? But you shouldn't be like hemorrhaging. You shouldn't be filling up pads. And if that is happening and you are pregnant, you should absolutely go to labor and delivery, go to the ER, make sure you get that checked out, because we want to make sure that's not something, that is called placenta previa, or we want to make sure that you don't have like something that we call an abruption, which is where, the placenta can start to separate from the uterus early on, right? So those are definitely times that you absolutely want to go in right away if you are pregnant and you bleed after sex, because you just want to make sure that it's nothing, right? It can just be something, maybe it's a little bit of spotting, maybe whatever. You just go, you get checked out, they do an ultrasound, everything's fine, baby's okay, they do an NST. But sometimes it can be something else. Maybe it was, where the placenta was lying over the cervix and you hadn't had an ultrasound yet, so you didn't know. And that's called placenta previa. And if that's the case, then you definitely, are not going to be able to have sex during pregnancy because you could cause that placenta to bleed. Okay. So those are two situations where you absolutely have to go to the doctor, have to get checked out, make sure it's nothing else going on. Okay, so what happens? So research shows that in perimenopausal women, the 2-year cumulative incidence, right? So the 2-year incidence of somebody that has sex after bleeding is about 7%. And about 51% of the time, it just resolves on its own and it doesn't happen again. So that's really reassuring and really important. And most of the time, I will say, these things, bleeding after sex resolves on its own. There's not really much you have to do for it. Okay. But of course, always go and get it evaluated. So let's talk about the most common reasons why somebody may have some bleeding after sex. Okay. And these are the benign reasons. And, this is what we see in most of the cases, right? So in one study, 85% of women presenting with bleeding after sex had benign findings. And what we noted was that there was some vascular cervical ectopy being the most common colposcopic finding. What that means is that basically there's a little bit of cervical tissue that can bleed, and that's the most common cause of that bleeding. Okay. There can also be some polyps. So polyps are like this, I guess I would call it like this little piece of tissue that can sometimes hang off of your cervix. Almost imagine that it looks like an upside down tree, right? So if you have like the trunk of the tree and then you have the bottom of the tree. So sometimes that's what they can look like. Other times, they can look differently. But those polyps, if there's anything that hits that polyp, it can cause it to bleed. Sometimes there can be these tiny little cysts on the cervix called Nabothean cysts. Sometimes, but rarely, I honestly have never seen this, is cervical endometriosis. There can be a little bit of trauma. There can be some unscheduled bleeding due to like new hormonal contraception. So, for example, if you've just started on your pills and it's not lined up with your cycle, you can have some irregular bleeding, right? Also in postmenopausal women, right? Sometimes they have bleeding. And if you have bleeding and you're a postmenopausal woman, you absolutely want to get it checked out. Make sure you talk to your daughter. I'm not daughter, your doctor. You could talk to your daughter as well, though. But what you want to do is you want to make sure that, sometimes you can have some postmenopausal bleeding if you just start on menopausal hormonal therapy and it's like, so let's say it's within the first 6 months. Sometimes that tissue that's in that lining of that uterus, right, it's been dormant for a while, so it's been kind of asleep. And so when you start hormones, sometimes it can activate that tissue a little bit. So some women can have some spotting within the first 6 months. Most of the time that's benign. Your doctor will have you come in, they'll evaluate you, they'll take a look at the vagina, the cervix, but also they'll probably have you go for an ultrasound and make sure that lining of the uterus is less than 4 millimeters in somebody that's postmenopausal. And, if you have a history of polyps or fibroids, sometimes they can also get activated with when you start hormonal therapy. And so, you definitely want to get that checked out. Also in postmenopausal women, let's say you haven't been using vaginal estrogen because nobody ever prescribed it to you and you didn't know. That tissue, when you have sex, can sometimes be really thin, and it can be really uncomfortable. And sometimes, if that tissue is really, really thin, you may have a little bit of spotting. Sometimes patients have something called lichen sclerosis or lichen planus that can cause like little cuts, right? And for lichen planus, the cuts can be on the outside as well as the inside. And for lichen sclerosis, the cuts can be on the outside. And so you really want to make sure that you get evaluated and, this gets addressed because like I said, most of the time it's benign that if you have bleeding after sex, but sometimes it's not. So you want to make sure that you rule that out. For most of the things, right, like cervical ectopy or small polyps, really nothing. We don't really do much for it unless there's a polyp that's just kind of causing you recurrent bleeding, then we may suggest, depending on how big it is, you may be able to have it removed in the office. If not, you may have to go for outpatient surgery just to have that polyp removed so that it stops bleeding. And a lot of times, we just for a lot of patients, they just want some reassurance, right, that they're okay. And sometimes, especially postpartum, right, and during breastfeeding or in perimenopause, the tissue definitely can be more fragile. And I mentioned that a little bit. And remember, any type of state in a woman's body, right, of somebody that has ovaries, where there is decreased estrogen, that happens postpartum as well, right? Because especially if you're breastfeeding, then those hormones, the estrogen, progesterone, are low, and so it can kind of mimic you being in a menopausal state in a sense. And so that tissue in the vulva can be friable, meaning like, it can be very fragile. And sometimes, it can bleed. And also, if you've had, let's say you had a little tear after when you delivered your baby, you want to make sure that that tissue is healed, right, as well. And, the vaginal estrogen really helps. So even if you are postpartum and, you're like, oh, I don't need vaginal estrogen, I'm not menopausal, why do I need that? Well, actually, vaginal estrogen will really help you in the vagina to help that tissue, right? To help that tissue heal. And especially when you're in a low estrogen state, that vaginal estrogen is going to help to bring back that blood flow and help that tissue become thicker. And so it won't be as fragile. Also, remember that during breastfeeding and perimenopause, that dryness can also happen. And sometimes if intimacy is rushed or, if you're not taking your time, spotting can also happen then. And so that's just physiology that happens sometimes. So when bleeding is not considered to be benign, right? So what are some of the causes for bleeding that's not benign? So I already mentioned two in pregnancy, which was placenta previa and placental abruption, right? Where that placenta starts to separate early. And remember, placenta previa is when that part of that placenta can cover the cervical os. Those are two reasons that bleeding is not benign. So you want to make sure you get that checked out. But some of the times where you definitely want to make sure that you get this bleeding after sex evaluated is, if it's persistent, right? If it happens all the time, every time you have sex, you have bleeding, that's not normal. So make sure you get that evaluated. If there's some type of abnormal cervical appearance, right? So your doctor does a speculum exam and they tell you that the cervix doesn't look right or there's something going on, then you definitely need to have that evaluated. Let's say you've had abnormal pap smears, right? Let's say that you've had like CIN, which stands for cervical intraepithelial neoplasia, basically like a precancerous lesion. And then now you're noticing that, you're bleeding a lot or something. But, not all abnormal pap smears are going to lead to bleeding, right? So that's important to also note. I'm not saying that, but I'm just saying that if you have a history of abnormal pap smears and you haven't followed up, make sure you go and get followed up because sometimes that can be the cause of your bleeding. Sometimes also women that have been pregnant lots of times, sometimes their cervix can be a little bit fragile or friable, what we call. So, you definitely want to make sure that you get that evaluated. Studies show that while most cases are benign, bleeding after sex carries a higher risk of perhaps something being wrong with the cervix than in the general population, right? So basically, 4 to 5% of cases are associated with invasive cervical cancer. 17% are associated with what I mentioned, the cervical intraepithelial neoplasia, right? So that's why it's so important to make sure that you're getting your pap smears, because if you have an abnormal pap smear, then you'll need a colposcopy. And a colposcopy, for those people that don't know what that is basically, we have you come in, we take a look. It's kind of like a little, I'd even say like a little telescope that looks at the cervix very closely. And if we see some type of tissue that looks abnormal, then we'll take a little biopsy, and that's what a colposcopy is. So you always want to make sure that you're keeping up with your pap smears, right? So it's really important to take, bleeding after sex seriously, because if you don't want to miss anything, right? The key thing here is that there are benign reasons, there are reasons that we get really worried about, and you just don't want to miss it, right? So most of the time it's going to be benign. There are some times that it's going to be, where we'll have to investigate further, but you just don't want to miss that opportunity to investigate further, right? So the average age of patients with invasive cancer in these studies that we looked at was about 41 years old, compared to 33 years old for somebody that had benign reasons for bleeding after sex. Okay, so that doesn't mean that younger women can't have serious pathology. It just means that maybe bleeding after sex when you're older, you really have to make sure that it's not, like a really bad reason, like an abnormal cervical cytology, meaning like abnormal pap smear, right? So you want to just make sure. So the studies that we looked at, it's noted that the women that were younger had more benign reasons for bleeding after sex, as opposed to women that were a little bit older that had bleeding after sex. So just important to get that evaluated. So if you go to your doctor and you go there for post bleeding after sex, this is kind of what happens, right? So they're going to get a thorough history from you. They're going to find out when this happened, how often, has this ever happened before, all that stuff, right? They're going to want to know your menstrual history. They're going to want to know whether or not you're using any type of contraception. They're going to want to know about any type of bleeding disorders or anything like that in your family. Then they're going to do a speculum exam. They're going to look carefully at the cervix. They're going to make sure that is the cervix friable, what we call, right? Does it bleed after something touches it? That could be the reason. They're going to look for discharge. They're going to look for any type of lesions. And sometimes, if it happens all the time, right? Like if you're bleeding after sex all the time, maybe they'll check your blood count, right? Just to make sure you're not losing a lot of blood. Maybe they'll check some bleeding disorder blood work, right? But it's not that common that we do that. And, I think that most physicians will just end up taking a look at the cervix and then the vagina, making sure that there's no tears, there's no lesions or anything like that, right? Only if you've been bleeding tons, right, after sex will they end up, working you up for abnormal bleeding, like doing like, to see if you have some type of bleeding disorder. But most of the time, like if you think about it, right, like if you are coming as an older patient, right, quote unquote older patient, so somebody that's in their 30s and 40s, and you're coming for bleeding after sex, you already know if you have some type of bleeding disorder, right? Like it's highly unlikely that, we'll find a bleeding disorder like in your 40s or 30, late 30s, 40s, that hasn't already been picked up when you were younger, right? So it's highly unlikely, because typically, when do we pick up bleeding disorders? It usually happens when a girl starts to menstruate, right? As a woman or a person with ovaries starts to menstruate. And, if they're having super heavy bleeding and all that stuff, that's typically when we will pick up a bleeding disorder. And because that's when it shows up, right? When they first start to have their menses, and how often it happens, and how irregular, and how much they're bleeding. It's highly unlikely that we're going to pick up a bleeding disorder later on in life, because, this individual's more than likely has been menstruating for so many years already. Okay, so when do we do a colposcopy? So remember, colposcopy is kind of like that telescope examination of the cervix that I mentioned to you. So, we would do a colposcopy. Typically, we do it for abnormal pap smears. We could also do it for persistent recurrent bleeding, but I'll tell you that most people don't do that. We do it, if we're really worried about the appearance of your cervix, yeah, sure, we would do that. But, we'd probably already know that you had some type of abnormal pap smear because, we would have been following you. Or if you're new to a provider, you'll let them know if you've had some type of abnormal pap smear. And colposcopy, of course, lets us see lesions that are not visible to the naked eye because it just magnifies those lesions. And sometimes, we can only see it under magnification. I also want to mention something that's rare but important, and that is traumatic injuries. So sometimes, lacerations that are in the vagina. So sometimes this can happen with let's say you're using some type of toy that you've never used before, and and you inserted it into the vagina and it caused a tear, right? That could be a way that sometimes that happens. Of course, at the time of delivery, sometimes women will get tears inside the vagina, but that we'll see, it will repair and things like that. But using toys sometimes, and if you're not familiar how to use them, or, putting something in the vagina that has maybe some sharp edges or something like that, that can absolutely, cause tears inside the vagina. And if it's really heavy, you want to make sure that you absolutely call 911 or you go to the hospital, because if you have a vaginal tear, you will not believe how much it bleeds. It can bleed so much. And especially from all the times that I've done, vaginal deliveries, we know that when you get a tear in the vagina, it bleeds like crazy. And granted, a woman is pregnant during that time so that she has, more blood flow and there's a lot of vascularity to that tissue. But in general, though, the vagina does bleed when when there's tears in it. So, especially if it's like a deep tear, you want to make sure that you go and you get that assessed. So that is super important. So what is the take-home message? So the take-home message for you guys is that bleeding after sex can happen. Most of the time, it's benign. Especially if it's a little bit, it can happen sometimes. But if it becomes a recurring problem, you absolutely want to get that checked out, right? If you have a history of abnormal pap smears and you start bleeding and you notice that every time you have sex, you bleed, you definitely want to get that checked out. If there's a new toy, a new sex toy or something like that you're using that you're unfamiliar with, you're not sure how to use, and then all of a sudden after you use it, you start to bleed heavy, you absolutely want to make sure you go and get that evaluated, right? Most of the time, bleeding after sex is benign, and most cases will just resolve on their own, right? But recurrent bleeding is a problem, and you want to go and get that evaluated. And, seeking care, right? If you're bleeding after sex is not something that you should be embarrassed about or, feel guilty or whatever. Women, we start to blame ourselves for everything. And I think the important thing to know is that if you're bleeding after sex, make sure you get that evaluated. It doesn't mean that you're broken. There's something wrong with you. There might be something going on and you just have to get that evaluated, right? So you have to take care of yourself. It's an act of self-respect and not fear. And remember, it's all about honoring your body. So if you feel like this episode has helped you, I'd love for you to share it with others. And, this happens a lot where women get bleeding after sex. It can happen. And if it happens, make sure that you go and get evaluated, share it with your friends and someone who might not feel comfortable asking this question out loud, right? And remember, as always, you deserve care that is respectful, thorough, and compassionate. You want to make sure that you go to a doctor that you feel comfortable asking all these questions to, right? And so while we are done here and it's been real and really intimate, remember that this is not meant to be any type of medical advice. So, of course, it can be helpful if you are having any bleeding after sex, but it's important to get evaluated. So let's just leave it at that. And remember that if you have any questions about your health, make sure you go see your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.